name is Amethyst Diaz, and I chose the topic of antisocial personality disorder. What is antisocial personality disorder? It is a chronic mental condition in which a person's way of thinking, perceiving situations, and relating to others are dysfunctional and destructive. I chose this picture because it just goes with it, with all the words that are on it and stuff, and it just goes completely with it. Um, the symptoms would be persistent of lying or dissonant of exploit others, recurring difficulties with the law, like as in always breaking the law, never following the law, completely against it. Child abuse and neglect, that would go under like more as a childhood growing up with parents being abusive, being really neglectful, and just not caring for them. Lack of empathy for others and lack of remorse about harming, so not really caring about how others feel if you harm them or so on. Um, Irresponsible work behavior, pretty much going to work, not caring what you do, not really wanting to work, being really lazy about it. Your boss always yelling at you, stuff like that. Agitation, impulsiveness, aggression, or violence, always getting in fights, not, like not really caring, being really agitated. That would be more like being like really frustrated and everything bothers you and it just makes you really like ticked off. Manipulating others for personal gain or personal pleasure would be more like, let's see, how can I explain this? More, let me see. Manipulating would be like trying to manipulate other people, doing this and stuff like that. A lot of the antisocial personality disorder symptoms may begin in childhood and be noticeable around the ages of 20, 30 years of age. The reason it begins in childhood, like I said, from neglect and abuse and, witnessing your parents fighting all the time and stuff like that. It could affect you in the long run. Symptoms of Cyteria would be being at least 18 years of age. So under the to be officially diagnosed under the DSM, you have to at least be 18 years of age or older, have had the symptoms of conduct disorder before the age of 15, act of stealing, vandalism, violence, cruelty of animals, and bullying, repeatedly breaking the law. So always, since really young, never always breaking the law, repeatedly or always lying, never telling the truth. Um, a lot of them, like all the disorders, they all have in common is always lying. Engaging in physical fights and assault. So starting as a minor, always getting in fights, always assaulting people, even teachers, your coworkers, and so on. Being irresponsible and repeatedly failing to honor work or financial obligations. So that also falls as in like going to work, never, just don't like working at all. And with schoolwork, going to school, never caring, never doing your homework, getting bad grades, skipping and stuff. Um, Feeling no remorse or justifying behavior after harming others. So not caring if you're hurting others. Like if example, you hurt your sister or you hurt your mother or whatever, you don't care. You don't care how they feel. Nothing like that. Um, there's the test example, the testings that they do, like physical exam. They'll do one to diagnose you. They'll do these three tests. The physical exam is to help rule out the other problems that could be causing symptoms and to check for any related complications. Lab tests would be to complete a blood count, a CBC, thyroid check, and screen for alcohol drugs to determine if there are any other causes of symptoms. And the psychological evaluation, which would be a doctor or a mental health provider, exploring the thoughts, feelings, relationships, behaviors, and patterns, and the family history, which may include psychological tests about personality. Doctors will also ask about the thoughts of suicide or self-harming or others, because that also, antisocial personality can get to the point where you just want to kill yourself or you have the thoughts of doing it and so on. Treatments would be there's kind of different psychotherapies. Psychotherapy is also called talk therapy. or counseling, focusing on helping you heal and learn more ways to deal with the problems and issues with your life. There's four kind of therapies, and there was more, but I was only able to get four on here. Behavioral therapy, which focuses on helping the individuals on how to change their behavior and can lead them to into like how they feel and stuff. Psychodynamic therapy focuses on unconscious processes as they manifest in person's present behavioral, understanding the influence of the past and present behavior. Cognitive therapy is based on the theory that much of of how we feel and determine on how we think. So mainly like how we think and what we're feeling and so on. Humanistic therapy is focused on self development, growth, and responsibility. The diagnosis, the forensics, psychology and psychiatrists and criminology use the term psychopaths and sociopaths. Experts disagree on whether there are meaningful differences between the two conditions. The fifth edition of the DSM, the Diagnostic and Statistical Manual of Mental Disorder, have listed both sociopaths and psychopaths under the antisocial personality disorder. These behaviors have four major common traits, which one would be disregard for the law and social mores, so not caring about the law, none of that. Disregard for the rights of others, so not caring what other people believe and so on. A failure to feel remorse and guilt, like I said, that's just not caring how people feel or any of that. Tendency to display violent behavioral, so always acting up in front of, in public, getting in fights and so on. I chose this picture as well because it goes with it, psychopath and the sociopath. The statistics, I got this was based on 2012, and this is that 25% of the population of the nation population would be United States, Colombia, France, Ukraine, and the New Zealand are the highest rates right now. But that was back in 2012. It was under the mental health by the Substance Abuse and Mental Health Service Administration. So this would be estimating about 350 million people worldwide, but only 5% of these mental illness are severely impaired and they cannot be worked with. The antisocial disorder is the most commonly typed, so about 4% of the general population. Sociopath is the second common type, with the American Psychiatric Association estimating 3% of all males in our society are sociopaths. The psychopaths are really rare, but are found perhaps in about 1% of the population, but 25% of the prison's population, and 4% among corporate CEOs. And these are all the other personality disorders. There's avoidant, the multiple personality disorder, borderline, narcissistic, schizoid, which I can't pronounce, and I can't pronounce this one either. Dependent, obsessive compulsive disorder, which is OCD, historic, and paranoid. These all, the most common in all of them is mainly breaking the law, feeling remorse for others, and being really like distant from people and stuff, and so on.